It's a pleasure to be with you all today. My name is Eric D. I'm co-founder and CEO of Bloomlife. Bloomlife, we are a women's health company redefining prenatal care. Our mission is to improve the health of moms and babies globally by eliminating preventable pregnancy complications. Our initial focus is the US market, and for good reason. The demographic trends driving America's birth outcomes are impossible to ignore. Over the past several decades, there's been a significant increase in the rates of high-risk pregnancies. Decades-long shortages of maternal health care providers have created significant barriers to care, affecting urban and rural communities alike. These factors put enormous pressure on patients and providers and starkly reveal the limitations of existing models of care, as evidenced by our higher rates of maternal mortality or morbidity. Providers today face challenges on all fronts. They have insufficient time per patient for comprehensive risk assessment and education. The growing number of high-risk pregnancies demands more of their time, but is not being met with increasing rates of reimbursement. The result? OBGYNs suffer the third highest rate of provider burnout of all medical professionals, leading to staff turnover and poor quality of care. For patients, existing models of care are outdated. It's still dependent upon antiquated technologies and doesn't take advantage of the opportunities of a connected patient. It still requires inconvenient, time-consuming appointments, provides little support and feedback between those appointments, and oftentimes leads to long referral times to see specialists, a problem that is particularly a problem for our underserved communities. The system is broken, and we believe moms deserve better. At Bloomlife, we are designing the future of prenatal care with technology to improve the health of moms and babies. We combine connected devices, data analytics, and virtual provider networks to increase access to care, empower moms, and increase the capacity of healthcare providers. Our approach to delivering prenatal care allows clinicians to more effectively screen maternal and fetal risk, educate the patient, and quickly access specialists regardless of their location. At the center of our solution is a clinically validated, discrete, and comfortable prenatal wearable that allows us to remotely assess fetal health from home in the form of what's called a fetal non-stress test. In the US, over 10 million fetal NSTs are performed every year in order to earlier identify signs of fetal distress that might lead to long-term neurological impairment or fetal demise. Current technology limits these tests to a clinical setting, and making it very inconvenient for a patient that often has to come into the hospital or doctor's office twice a week starting in the third trimester until they deliver. Our technology moves that to the home, and in addition, also performs better in high BMI women than the current standard of care. For providers, we improve quality of care and increase capacity by enabling remote screening and management of risk. With the data we collect, we're able to increase visibility on patient adherence, give them information to do proactive risk management, to earlier identify deteriorating maternal and fetal health conditions. Through software automation, we're able to reduce overhead and cost and introduce new billable services. And lastly, the digital tools that we're creating really help facilitate patient-provider communication, which is foundational for quality prenatal care. For patients, the whole idea is reducing the burden on managing pregnancy complications and supporting confident self-management. Through remote monitoring technologies, we're able to reduce the number of visits for clinically recommended tests, such as the fetal non-stress test, saving patients time and money. With data we collect from home, we'll also be able to provide moms real-time feedback and clinical oversight, providing peace of mind in between their appointments. And the personalized education we deliver helps normalize mom's experience, help her understand her condition and how to manage it. We've talked to thousands of moms, and we know that they want to have more information about their pregnancy and they want to be more in control. And we make that safe and easy for the benefit of mom and providers alike. Our business model is simple. We contract with provider organizations to provide remote prenatal screening services. Doctors order our services for their patient and bill insurance companies using an existing set of reimbursement codes and pay us a portion of that reimbursement. In addition, our tech-enabled service allows reuse of hardware from patient to patient. This not only provides better profit margins, but it provides a more ecologically conscious solution to the market. From a market perspective, in the US, we spend over $110 billion a year on pregnancy, childbirth, and postpartum care. And in fact, for commercial and public payers, maternal health is typically one of the top 3 to 5 cost drivers of plans. And while we envision a world where all pregnant women are supported by Bloomlife, we're initially focusing on high-risk pregnancies that have the highest rate of adverse events, require the greatest amount of clinical oversight, and consequently drive the greatest amount of care. As we incrementally increase the services we offer, we increase value to patients, increase revenue per pregnancy, and the ultimate market opportunity. Focusing today on just the fee-for-service model, we address a $2.7 billion annually renewing market in the US alone. Over time, the idea is to generate the necessary clinical and financial data to move into at-risk value-based contracting with payers, further increasing revenue opportunity per pregnancy and the market size. From a competitive standpoint, at Bloomlife, we are obsessed with user experience to deliver best-in-class performance with ease of use. And beyond delivering a superior product experience, we are building the most comprehensive solution on the market. Our suite of virtual care services enables provider organizations of every size to unlock the value of remote prenatal care. From a pure technology standpoint, compared to the competition, our prenatal wearable matches the output of standard of care CTG machines more directly. Translating to clinical practice, what this means is that there's going to be less false positives and unnecessary care for things such as symptomatic preterm labor. We also know that workflow integrations are critically important, and we transmit our data directly into the EMR and the software tools providers are using today, eliminating the need for multiple logins and new workflows. And the last competitive advantage that we're working on right now, and perhaps the one I'm most excited about, is in collaboration with our partners, we are aggregating the largest and most comprehensive data set on maternal fetal health ever collected. This critical data that's been impossible to capture till now is powering our cloud-based machine learning analytics to develop digital biomarkers to help doctors earlier predict pregnancy complications before it's too late. Our team has the necessary technical, commercial, and medical expertise to transform maternal health. We have industry-leading experts on remote patient monitoring that have developed and commercialized remote patient monitoring solutions for companies such as Cala Health, Johnson & Johnson, and IMEC. Our clinical program is overseen by a triple board-certified maternal fetal medicine specialist with a background in clinical research. Beyond a professional experience, many of us have personally experienced the challenges of navigating a high-risk pregnancy. And in fact, the inspiration for Bloomlife came from my wife and I's journey into parenthood that included years of fertility treatments, a high-risk pregnancy with several complications, preterm birth and postpartum hemorrhage, and many months in the NICU. We have already pioneered the consumer maternal health market and launched the first prenatal wearable for moms. We've shipped to thousands of women throughout the US and seen firsthand the profound impact empowering women with tools and information to better understand their pregnancy can have. We've also seen the opportunity for these technologies to impact clinical care. And to take advantage of this opportunity, maximize impact, and increase our market size, we have transitioned from a consumer into a medical business. Over the past 18 months, we've begun ISO certified, had multiple meetings with the FDA, further developed and validated our prenatal wearable in partnership with Ochsner Health and Valley Perinatal Services, and submitted our first FDA submission, which is currently under review. We've also started doing select commercialization with partners in Arizona. Given Bloomlife's unique consumer health insights and technology backbone to make maternal health more equitable and scalable, we are uniquely positioned to build the category-defining care delivery platform for women globally. In support of this effort, we're raising $20 million to strategically expand our commercial base, further add clinical services to augment the existing clinical teams, and commercialize our remote NST solution. At Bloomlife, we see that the role of technology in improving our lives is all around us. And at Bloomlife, we believe it's time to start applying the technologies to where it matters most, saving millions of families from the heartache of a lost child and making more healthy moms and babies in this world. Thank you.